name is Johan, and I'm gonna be performing the abdominal physical exam. Uh, uh, Here's Yvette. This is she's gonna be my patient for today's video, and for the purpose of this demonstration, I'm gonna consent her, and she will agree for me to upload the video for grading. Hi Yvette, you're 18 years older.
Yes.
Do you agree for me to perform a physical exam on you and record this session and posteriorly publish this video on YouTube?
Yes.
Okay, can you please lay down? Thank you. I'm gonna to uncover the abdomen. Okay, it is important to remember that this video is being recorded with a front-facing camera. So this is my left hand, this is my right hand, this is the patient's right hand, and this is the patient's left hand. So we're gonna start the physical exam. The physical exam in the abdomen is the only exam that breaks the parameters. So we will start with inspection. Then we're gonna auscultate the abdomen. Then we're gonna percuss the abdomen, and then light palpation and deep palpation. Again, this order is only for the abdomen. So we'll start with inspection, and during inspection we're looking for striae from previous pregnancies, birthmarks, lesions, deformities. We also see if the abdomen is symmetrical or asymmetrical, and we're looking for signs of previous surgeries. Also, we can angle ourselves a little to make sure that there's no pulsations in the abdomen, which will indicate that the aorta is pulsating. That could be a AAA, which is an aortic aneurysm, and there are other techniques that can be used to identify that problem. Also, we can see around the umbilical button if there's any sign of discoloration that could indicate pancreatitis, or any other discoloration that could also indicate if the patient has any sort of liver problems, pancreas problems, like jaundice. So we proceed. We see some surgical marks that are from previous surgery, some striae that probably belong to previous pregnancies, and the abdomen is flat and symmetrical with no deformities. There's also, during the assessment, we can do this for the end of the assessment, which is to assess for fluid in the abdominal cavity, looking for ascites. Again, we're gonna start performing the auscultation part. So for that, we're gonna use the diaphragm part of the stethoscope, and we're gonna move clockwise, starting from the right lower quadrant, right upper quadrant, left upper quadrant, and we end in the left lower quadrant. We listen about between 3 and 15 seconds to try to listen for peristaltic digestive movement sounds. For this part of the auscultation, we can determine that the sounds are normal active, which means that there's no accelerated or hypoactive bowel movement in the patient's abdomen. Now we're going to proceed to auscultate the aorta, the renal arteries, the iliacs, and the femoral arteries. We're looking for broods, which is a sound that a turbine-like sound that could indicate obstruction. And for this, we use the diaphragm and the bell of the stethoscope. We start with the aorta. We move to the renals. And then we continue to the iliacs. We keep moving down now to the femoral arteries. In our findings, we can indicate that there's no bruit, there's no turbine-like sound, there's no abnormal findings. For the purpose of this exam, we auscultate the femoral pulses over the pens to maintain privacy of the patient. Now, after auscultation is concluded of the abdominal part, now we're gonna move past to percussion. We percuss first because with deep palpation or light palpation, we can alter the sound of the organ and the position of the organ. So we want to prevail to keep the abdomen as intact as possible. So we're gonna percuss with our dominant hand on the second and middle finger on the distal phalange of the finger. My hands are gonna be a little cold, okay? And we start from the left lower quadrant, move around in clockwise. Sounds in the abdomen are tympanic, which indicate that there's fluid and air inside the hollow organs of the abdomen. Now we're gonna percuss the liver and the spleen, and we're looking for a dull sound, which is gonna be different, which indicate that it's normal. We have found the liver between 7 and 10 centimeter mid-clavicular line, which indicates that there's no inflammation. If it would be bigger, the location of the liver, that could indicate an inflammation of the liver. Now we're gonna try to percuss the spleen. Normally the spleen is not found unless there's some sort of abnormalities. Sound is tympanic, which means we couldn't feel the spleen. Now we're gonna start with light palpation. Before starting with light palpation, we'd like to instruct the patient to cough and looking for signs of pain. If the patient is able to cough freely, that means that we can proceed with light palpation. Can you cough, please? Any pain?
No.
Okay, we can proceed with light palpation. With light palpation, again, we're looking for skin abnormalities and some bulging figures in the abdomen, like masses, abnormal tissues that they're not supposed to be there. Light palpation is done with one hand. There's no abnormal masses found, which indicate that it's normal. And we're gonna start with deep palpation. For the purpose of this exam, because of the physical conditions of the room and the position of the camera, I'm gonna have to perform this sitting, but this is advisable to do in a standing position with two hands. I'm gonna use two hands for deep palpation. I'm gonna use deep palpation now. If you feel any pain anywhere, let me know, okay?
Sure.
There's no masses, no abnormalities in the abdomen. All the surrounding tissue and organs seems to be in normal sizes. Now we're gonna try to find and locate the aorta. The aorta runs to the left of the sternal part of the chest, so it's like around here. So we're gonna try to isolate the aorta, looking for any abnormal pulsation. There's no abnormal pulsations, which indicate that the aorta is not enlarged and there's no aneurysm. Moving forward, now we're gonna try to palpate the liver, the spleen, using some techniques. So we're gonna instruct the patient to take a deep breath. We're gonna hold with the right hand under the rib cage, and then we're gonna ask the patient to release the air. This, if there's any pain at any point, this will indicate that there could be a possible cholecystitis. So now we're gonna assess. We're looking we're gonna measure the size and position of the liver and try to find the spleen. For this technique, I'm gonna use my right hand to try to feel under the costal cage, the right costal cage, and with the left hand, I'm gonna try to lift the patients to try to push the liver towards me. Okay, take a deep breath. Lift, let it go. And we're feeling the liver, which has soft edges and is not enlarged. Any abnormalities will include abnormal edges or hard edge of the liver. Now we're gonna do the same technique for the spleen. In this case, the spleen should not be felt. If we feel the spleen, that indicates that there's a process of inflammation in the spleen. Take a deep breath. Let it go. All right. And there's we didn't feel any organs, we didn't feel the spleen, which indicates that there's no inflammation process going on. Now we're gonna do the abdominal techniques to try to see if the patient has any process going on. The first one will be a Morpheus sign. This is elicited when the patients take a deep breath and we put our hands under the costal cage. Can you take a deep breath? Let it go. Any pain?
No.
That's negative for a Morpheus signs, which indicates that the gallbladder is not inflamed. Now we move down and we try to find McBurney's point, trying to look for signs of appendicitis. The McBurney's point is located midline between the umbilical button and the right iliac crest. Right iliac crest and the umbilical button. So McBurney's point is here, and we use 2 fingers. You feel any pain?
No.
That's negative, which indicates that the patient doesn't have any appendicitis or inflammation. Now we do the Rothstein signs, which is a pressure applies to the left lower quadrant. The abdomen, and positive sign will be if the patient feels any sort of pain in the right lower quadrant. Any pain? Which is negative. That's also indicative, if it's positive, that the patient could be having appendicitis, some sort of ileus disease, or peritonitis. Now we're gonna do the psoas exam. Okay, for this technique, we're gonna ask the patient to bend the thigh against all fours. Can you lift your right leg? Lift. Any pain?
No.
Can you lift your left leg? Any pain?
No.
Which is negative and indicates that the patient doesn't have any inflammation process in the abdomen, such as peritonitis. And for the same purpose, we're gonna test for the obturator test. In this case, we're gonna ask the patient to bend the leg, and we're gonna abduct the patient's legs and hips towards the opposite side. Can you bend your leg here, please? Any pain? Now the left leg. Any pain?
No.
Okay. So this is negative. Any pain elicited by the patient during this movement could indicate some abdominal process, such as peritonitis. Now, to conclude the exam, we're gonna finish our assessment for ascites or fluids in the abdominal cavity. For this, we're gonna use the patient hands because we don't have any medical assistant in the premise. We're gonna ask, can you please take your hand and put it here in the midline? So we put it in the mid sternal line over the umbilical bottom, and what we want to do is to tap the abdomen to see if there's any wave transferring to the other side. There's no wave. There's a second assessment that we can do if we suspect of this, which is by turning the patients to the side, and in this case we will see how the fluid in the abdomen would travel to the other side of the patients when we turn the patient to the side. This concludes our abdominal exam. Thank you so much for your cooperation. This is it.
Thank you.
Thank you.